Welcome to our webinar. As you're getting logged in, on the screen, you'll see two surveys, one for patients and caregivers and one for healthcare providers. We ask that you please go ahead and complete the survey that most represents you. Welcome again to everyone who's joining. We're giving folks just another moment to log in. On the screen, you see two QR codes, one for patients and caregivers and one for health providers. We would very much appreciate if you would scan the code that most represents yourself and complete the short pre-survey. This helps us learn throughout how our programs are doing and how we can do better in the future. Good afternoon, everyone, and welcome to today's culinary medicine webinar, Building Strong Bones While Following a Gluten-Free Diet. We're so glad that you're all here. Maintaining bone health on a gluten-free diet can be challenging, but it doesn't have to be. Today, we're going to explore the latest research and practical strategies to optimize bone-supporting nutrients with guidance from our expert panel. Of course, as always, we have a doctor, a dietitian, and a medical chef here to lead us through today's seminar. I want to offer a huge thank you to SHAR USA. SHAR has been working with us on culinary medicine programs for quite some time, and we are just so grateful for their ongoing support to make these programs possible. Before we begin, I want to highlight that live translations are available in Spanish and Portuguese. The Celiac Disease Foundation is committed to global leadership, and ensuring our programs are accessible in multiple language is an important part of that mission. To access the translations, please click on the globe icon at the bottom of your screen and select your preferred language. Today we have Spanish and Portuguese available. This session is accredited for 1.0 continuing education units for physicians and dietitians through the Boston Children's Hospital Department of Medical Education. Be sure to stay until the end for the details on how to claim your credits. So let's get started. So, what is culinary medicine? Culinary medicine is an evidence-based field that brings together the medical, nutrition, and culinary knowledge to assist patients in maintaining health, preventing disease, and treating it. It's something that we believe is very important in the journey for patients with celiac disease and for the providers who care for them. Today, we have an amazing lineup of speakers to guide us through. Dr. Dawn Adams, who is a gastroenterologist from Vanderbilt University Medical Center, Megan Donnelly, a dietitian from the Celiac Disease Foundation, Molly Winston, a registered dietitian and medical chef, and that's me. I'm Vanessa Weisberg, the Chief of Education and Community Engagement for the Celiac Disease Foundation. So without further ado, I will turn it over to Dr. Dawn Adams to get us started.
All right, thank you for that introduction, and I'm excited to hear what we learned today. So I'm going to give you all the medical side of bone health and celiac disease. Okay. All right, so let's get started. We talk about bone health, and a lot of times you might hear words about what is describing bone health. And you hear these words like celiac disease patients are at increased risk for osteopenia and osteoporosis. But what exactly does that mean? So this is referring to thinning of the bones. And essentially osteopenia, osteoporosis are a spectrum. So osteoporosis is the severe bone thinning and osteopenia is the less severe bone thinning. And how you define this typically is done by something called a bone density scan or a DEXA scan. So you may have had one of those, or you may have heard your doctor recommend one of those with celiac disease, or you may know someone else that had one. A bone density scan is essentially estimating how porous our bones are. So if you look at the pictures that I have here, you can see the healthy bone compared to osteoporosis and severe osteoporosis, and you have more of these holes and gaps inside the bone. So osteopenia is, again, a lower range of bone loss. And when you get a DEXA scan, it's usually represented in what's called a T-score or a Z-score. Now, a T-score and a Z-score can get kind of confusing, and I don't want to get too into the weeds about this, but essentially, in celiac disease, a lot of people that are getting DEXA scans aren't women that are postmenopausal. And DEXA scans with T-scores were originally described for postmenopausal women. So we sometimes need to look at something called a Z-score, and this is just dependent upon if it's matching you with your age-matched control or a generalized matched control. And so we don't really have a great definition of osteopenia for women that are premenopausal or for men. So technically the Z-score isn't really recommended, but you may still see people describing as, oh, it looks like you have some bone loss on your bone density scan. Risk factors for osteoporosis and osteopenia, aging, of course, smoking, low calcium intake, sedentary lifestyle, and we'll review why some of these things are important in the next couple of slides, and a big one, malabsorptive conditions. And so that's why celiac disease is such a high risk for osteopenia and osteoporosis, and that's the same risk factors. Most people won't know that they have osteopenia and osteoporosis. Sometimes my patients will say, I don't have any bone pain. Well, you're not going to have bone pain if you have thin bones. You don't have a problem until you have a fracture, and you really want to prevent getting to the point that is a fracture. So, how common is bone loss in patients with celiac disease? We actually find somewhere pretty big ranges in different reports, but between 10 and up to 50% of men and premenopausal women, and these are people that typically do not have osteoporosis, right, or osteopenia, premenopausal male, 50%, that's a pretty high number, right? These are patients with celiac disease. And osteoporosis, 4 to 20%. So significant. Patients with celiac disease have an increased fracture risk about 1.5 times someone with the same age and same gender that does not have celiac disease. And so that's a big deal. Why do we think that patients with celiac disease have impaired bone health? Well, it's due to primary malabsorption, but we also think that other factors are playing a role here. And this is a complicated science slide, but the reason I put it up for you all to see is that there are many things going on in someone that has celiac disease that's going to increase your risk of having poor bone density. And so it's not just, oh, my diarrhea is better and I'm absorbing better, I'm going to have better bones, but we really got to get the celiac disease under control. So what can you do and what do we do as healthcare providers? Well, interestingly, different societies have different recommendations on what we should be doing for patients with celiac disease and bone health. Everyone really agrees that it is an issue and that we need to bring it up and think about it, but do we need to be doing, for example, bone density scans on all patients? Should we be just doing labs? Are there markers that we can be looking at in the blood? Should we be routinely recommending over-the-counter supplements for everyone with celiac disease, regardless of if they've had a bone density scan or not? And at what point should patients go on medications? So all of these things come up, and you might hear different things from different providers depending on what their school of thought is. But I think everyone agrees that bone health is important. So bringing up bone health with your provider is very important to ask, what do you think about bone health and celiac disease, and what should I be looking at? So these are some things your provider might do. Some lab work. So vitamin D is a very common lab that's commonly checked in patients with celiac disease, and we do see a lot of vitamin D deficiency in celiac disease. Parathyroid hormone or PTH, you might sometimes see that on your lab work. That is a natural hormone that's made in the body. It's released when our body is feeling like it doesn't have enough calcium. So it essentially tells the body, we need more calcium. Where are we going to get it from? We're going to eat our bones up to get our calcium. And so a lot of times my patients will say, well, my calcium on my blood test was fine, right? So you get a blood work and you see all these things like sodium, potassium, and then you see your calcium and it looks totally normal. And so they say, my calcium's normal, I don't need calcium. Your blood calcium is not a good marker of how much calcium you're intaking, how much calcium you're absorbing, or how much calcium is in your body. What I like to tell my patients is your body will do whatever it can to keep that blood calcium normal because it's so important for so many things in our body, from making our heart beat to making our muscles contract, for example. And so we use these other markers like the parathyroid hormone, which goes up when our body is eating up our bones essentially to keep that blood calcium normal. Magnesium is another one that is often checked in celiac disease and in patients with bone disease. Some others that might be checked are things like vitamin K. Sometimes there'll be some calcium urine tests that are done as well for a little bit more advanced bone health. DEXA, again, so I brought this up, like, does everyone need a DEXA scan? My practice right now is that I do get a DEXA scan on everyone after they've been gluten-free for a year. Some people recommend risk stratifying. So no weight loss, for example, young, healthy male, less likely to have bone disease, maybe doesn't need a DEXA scan. But those guidelines aren't clear, and many societies do just recommend bone density scan 1 year after gluten-free diet. When you're meeting with your provider, bring up what you're taking, supplements. So a lot of times when you go to your provider, they just ask you what meds you're on, and you think about listing all the prescription meds or say, I'm on no meds. But supplements are really important. And so just bring them if it's confusing. Because sometimes, you say, I take this one for hair, I take this one for nails, and like, what's in there? So bring your supplements when you go to your provider if you're going to talk about bone health, because a lot of them are going to have D and calcium in, and we can add that up and see what you're getting. Other things that are important for bone health is exercises, and we'll talk about this. So calcium, I think we're going to get more into detail in this when we move into the dietitian section, but briefly just wanted to talk about what calcium is. It's a mineral. It's needed for us to build and maintain strong bones and teeth. It's not made in our body, and so we need to get it from foods that we eat. And as I mentioned, if our blood calcium goes down, our body is going to make up for that by eating up where our calcium is stored, which is our bones. And so over time, that leads to weaker and weaker bones. The recommended intakes are listed here, and that varies based on age and gender, but these are just general recommended intakes. So you may find that we want to push that a little more in someone with celiac disease. These are some examples of calcium-rich foods. A lot of patients with celiac disease also have lactose intolerance, and so sometimes it can be difficult to find a good balance of calcium intake since so many of the calcium foods are dairy. What I like to remind my patients of regarding that is that dairy-free and low lactose, lactose-free are very different things. So when we can have a patient with celiac disease reintroduce dairy, even if it's low lactose dairy, that can be really helpful. It introduces some great, quick gluten-free snacks, and again, great source of calcium. And another caveat we like to remind people of is that we can only absorb a certain amount of calcium at a time. So, sometimes if you're going to take a supplement, we want to mix that up throughout the day. Vitamin D is very important for calcium absorption. And again, we also need to be getting this from our diet. We also get this from sunshine. So in the summer, you may get your vitamin D measured and it's great. And then you get it in the winter and it's tanked because you're getting sun exposure and it's it's creating vitamin D for your body to use. These are the recommendations for vitamin D. We recently had a change in how we describe how much vitamin D is between something called international units to micrograms. So when you're describing how much vitamin D you take to your provider, make sure you note the units. If you see up at the top, you see IUs versus mcg. Just make sure you're letting them know which one you're describing it in. Other micronutrients that we talk about in bone health are magnesium and vitamin K, as I mentioned. It's very important that you just get a diverse diet to help your bones. If you're eating a very diverse diet, you're going to get a lot of these things naturally that are going to provide you with healthy bones. Some other micronutrients that can be important, I've listed here at the bottom as well. And again, different providers have different thoughts on what to push, but everyone agrees looking at calcium and D is very important. Another thing that we really stress is exercise. So in addition to getting what you need in terms of intake, you also need to strengthen your bones through exercise. Exercise keeps our bones strong and healthy. And so we need things to do on a daily basis to help us with this. Persistent daily exercise is going to be better for our bones than like intermittent bursts of exercise. So, different types of exercise that we think about with bone health and celiac disease. Resistance exercises, these are really great, and these consist of like lifting weights, using your own body weight, using bands. These can be really easy to do. You don't need to join a gym to do this. You can buy a couple of small weights or those bands and do these at home. Weight-bearing exercises like walking, hiking, jogging, dancing, stair climbing, any of this is also going to be good for the body. In addition, balance exercises. Balance exercises we really stress too as people get older, because if your bones are susceptible to breakage, you want to maintain good balance. Falls are going to be your enemy. Really, really recommended that if you're worried about your bone health, or if you already know that you have poor bone health, that you start with low intensity. If you have access to or can afford a physical trainer, I highly recommend that because you really want to make sure that you're learning how to do these exercises with proper form. Because if you're actually doing high intensity exercises with improper form and you have a low bone density, you can actually hurt yourself more than help yourself. So you want to introduce this slowly and try to do this every single day. This is a diagram, and I just wanted to show you what is the prognosis and how do we think about what's going to happen as we go gluten-free. Well, we know as you're gluten-free, your inflammation is going to slow down. You're going to start improving your absorption through mucosal healing. And so many patients, just after a year of gluten-free diet, will have a significant improvement in their bone mineral density. You'll see drops in that hormone that breaks up your bone, and you'll see improvement in vitamin D levels. This is why many providers, including myself, we don't do a bone density scan until patients have been gluten-free for about a year because we just want to see what it looks like after we've gotten that improved absorption. And so this graph here, the black bars are people percent of bone loss before they were on the gluten-free diet, and then you can see after that they've significantly improved. And so in general, people's Z-scores get better both as time goes along. We tend to see this stabilize out around 3 to 5 years. Most of that improvement's going to come in year one. So when I do my year one bone density scan on my patients, if I do see significant bone loss, I usually go ahead and send them to a bone specialist to start having discussions on advanced treatments if needed. Another thing is if your celiac disease is under great control and you've gotten your baseline bone density after a year of gluten-free diet and things are great, you're absorbing well, your blood tests are good, your biopsies are good, you don't have to continue getting bone density scans until you reach other risk factors like postmenopausal or something else happens. So in summary, bone health is very important for long-term management of celiac disease due to the increased association with bone mineral density loss. Most people will have improvement of their bone density a year after a gluten-free diet, and is another reason why, especially in people that are asymptomatic, we really need to push gluten-free diet in people with celiac disease. I think it's really important that you discuss bone health with your doctor. Make sure that they're at least having the discussion with you and maybe doing lab work and or imaging tests if they think that's necessary. And review your calcium and D intake with your dietitian. As I mentioned, bring your supplements, tell them about your diet, let them know what you're eating. And then performing regular exercises to keep your bones strong. Consider personal training, and if you have pain, please stop and consult with your provider. All right, that's what I have. We'll move on.
Okay, thank you, Dr. Adams. That was great. I'm gonna share the nutrition part of the presentation. Give me 1 second. Okay. All right. So, as Vanessa mentioned at the beginning of the presentation, my name is Megan Donnelly, and I'm the registered dietitian at the Celiac Disease Foundation and the director of health communication. So I'm going to take you through some of the key nutrients that we just saw in Dr. Adams' presentation, but I'm also going to try to give you some ideas for how to meet these nutrient goals, because I think that's a very helpful exercise when you're first learning this, especially. So, as Dr. Adams mentioned, calcium is one of the most well-known nutrients for bone health, and it's really important for building and maintaining strong bones. So your body's storing calcium in your bones, and if you don't get enough from food, your body's going to have to take it from your bones, which then weakens them over time. So we find studies actually show that people in the United States are generally low in calcium intake, and some people only are getting about half of what they need. This is especially true if dairy is limited. So we'll talk about dairy because I know it's definitely something people have trouble tolerating, but hopefully we can help you figure out ways to get in the appropriate amount of calcium if dairy intolerance is an issue. So I have the recommended daily amounts, which do vary by age, as Dr. Adams mentioned. And when I look at the food sources, yes, you can get calcium from dairy products, but there are plenty of non-dairy sources as well. Things like almonds, tahini, which is just ground sesame seeds, um, hazelnuts, leafy greens, certain fish like sardines and salmon. So if you're following a gluten-free diet, it's really important to make sure you're getting enough of the calcium-rich foods, but also a variety of calcium-rich foods. It's not only about dairy. And as Dr. Adams mentioned, absorption from calcium is highest in doses of 500 milligrams or less. So you want to spread your calcium intake out throughout the day. Um, Absorption from dairy products is a little bit better. It's at 30%. And compared to things like leafy greens, where the absorption might be a little bit lower. So you don't need to worry so much about these numbers. And in reality, the message really is a variety of sources of high calcium foods is going to give you the best opportunity to meet your needs. And also, you're going to get all the other wonderful nutrients that are in these foods. So, just want to briefly touch on things that can negatively affect calcium absorption. Um, Calcium intake from food or supplements, like I mentioned, should be spread out throughout the day. But you want to think about some of the things that might be affecting your ability to absorb it in a given meal. So, caffeine and phosphorus can slightly reduce calcium absorption. This is a relatively minor effect, but it is something to think about. You know, if you're having your cup of coffee with your yogurt, you might not be absorbing quite as much. And actually, I would advise taking your supplements separate from your coffee for that reason. It's just you're going to get better absorption when you take them separately. Vitamin D status is one of the biggest factors that affects calcium absorption. And I'm going to talk about vitamin D in greater detail in a minute. But this is one of the reasons that, again, you want to be getting your blood work done and you're speaking with your doctor about your bone health when you're in those appointments. I think Dr. Adams' suggestion to bring your supplements is an excellent one. I completely agree. Alcohol intake is another factor. We've seen that excessive alcohol consumption, which, for generally speaking, is considered more than 2 drinks per day, has been linked to bone fragility. So the US dietary guidelines recommend no more than one alcoholic beverage per day. I think that's a good general health guideline, but also it is that will also support your bone health if you adhere to those guidelines. All right, so on the what if you can't tolerate dairy question, I know a lot of people can't tolerate dairy. I think the point that Dr. Adams made about lactose intolerance versus dairy intolerance is an important one. So there are lactose-free dairy options. There are also low lactose dairy products, things like Greek yogurt or hard cheeses are going to be lower in lactose. And so if you're lactose intolerant, there's a lot of solutions there. If you have a dairy allergy, obviously that doesn't work. You're going to need to avoid all dairy-containing foods. So the good news is that you can meet your needs through non-dairy foods. It's just going to require a little bit more thought. For example, 1 cup of cooked collard greens has 270 milligrams of calcium, and a small serving of sardines with bones provides 325 milligrams of calcium. And so you're already at about a little bit more than half of your needs, and you can supplement with things like nuts, seeds, beans, and leafy greens. I have an example I have two examples here, actually, both getting you pretty close to the recommended 1,000 mg of calcium daily. Um, I usually try to break this out for people by saying 4 to 6 servings of high calcium foods per day will get you pretty close. So these are some examples of ways you can do it. Of course, there are other combinations. I'm going to show more meal examples a little bit later on, but this is kind of a template that I use a lot with people. All right, so on to vitamin D. As I mentioned before, vitamin D is just as important as calcium for bone health because it helps your body absorb calcium. If you're not getting enough vitamin D, even a high calcium diet won't be enough to maintain strong bones. So you can get vitamin D from food, but you get the most from sunlight. So there are like these few food sources are things like salmon and sardines and egg yolks and shiitake mushrooms, but really getting 10 to 20 minutes per day of sunlight is the best way to meet your vitamin D needs. Now, unfortunately, sunlight is not always the most reliable source of vitamin D. The season, your geographic latitude, use of sunscreen, if there's any smog in the air, your skin pigment, even your age can affect how much vitamin D your body absorbs through the sunlight. And, the reality is a lot of us spend a lot of time indoors. And so low vitamin D levels are really common. And a lot of people need a supplement. So we'll talk more about supplements in a little bit, but I do acknowledge that this is one a lot of people need a supplement for. So magnesium, as Dr. Adams mentioned, is another key nutrient for bone health. It works alongside calcium and vitamin D to support bone formation. So a lot of people don't realize that without enough magnesium, vitamin D can't do its job properly. You can kind of think of magnesium, calcium, and vitamin D as teammates. They're all supporting each other to do their jobs well. And so even supplementing with one of the three isn't beneficial if you're not getting enough of the other nutrients. So you need to be thinking about your overall intake of these nutrient-dense foods in order to really have strong bones. And so again, the point Dr. Adams made about a variety of high quality nutrient dense foods is really going to be your best bet. So I have some food sources of magnesium here. This, things like nuts and seeds, it's really easy to just have a handful of pumpkin seeds and almonds, and you're going to meet your needs pretty quickly that way. Also, chia seeds can be a nice one. If you make chia pudding, that can be a nice way to meet your magnesium needs. Of course, leafy greens kind of have all the important nutrients, which is really great. And then things like beans and quinoa and edamame can also be good sources. All right, so moving on to vitamin K. Vitamin K is a little bit different than the others. So vitamin K helps activate a protein called osteocalcin, which helps minerals bind to bones and makes them stronger. So without enough vitamin K, your bones might not get the minerals they need. But unlike the other nutrients we've been talking about, we're not necessarily thinking about vitamin K assessment in terms of supplementing. Vitamin K, you can take it in through foods like leafy greens, soy products, including soybean oil and fermented soy products, especially natto. That's a really good source of vitamin K. Also, certain cheeses have vitamin K in them. But your body also can make some vitamin K thanks to the gut bacteria. So this is one where intake is important, but it's really just a supporting nutrient. And I find that for most people, if you are eating leafy greens on a regular basis or just getting a variety of vegetables in your diet in general, vitamin K deficiency isn't so much of an issue. So again, just rotating, getting a lot of fruits and vegetables and high fiber foods in your diet, it's going to be a good starting point. The one thing with vitamin K is if you're on a blood thinner, you should talk to your doctor about your intake of high vitamin K foods. This is really important because they can interfere with the function of those medications. So just again, always talk to your doctor about what you're doing, whether it's supplements or medications. They can help you work out some of these details, and a dietitian can help you find a food solution. All right, so I'm going to leave this up for a couple, well, for a minute or so. These are some examples of ways to meet your calcium, magnesium, vitamin D, and even vitamin K needs through food. I try to create a variety of meal types. So this is kind of my idea of what bone-friendly meals would look like. Of course, there are others. Feel free to screenshot this slide and take a look and see if, there's definitely endless possibilities of meal combinations using these foods. But I think that it can be helpful to see how these things might be laid out over the course of a day. All right, I'll move on. All right, so now the big question that everyone always has for doctors and dietitians is, do you need to take supplements to have healthy bones? And I think this really depends on several factors. Of course, your current diet, your medical history, your ability to absorb nutrients, the status of your celiac disease. Are your intestines healing? Um, as a dietitian, I'm always trying to encourage getting nutrients primarily through food. There are some exceptions to this, of course. For example, vitamin D, as I mentioned, it can be hard when you live in places where it's cold in the winter and you're not outside a lot and it's very gray. There's not a lot of sunlight. So vitamin D is often one that I'm going to be recommending. But I think it's important to reevaluate these things over time. I think, just because a supplement makes sense at one phase in your life doesn't mean you need to be on it forever. And I think continuing to have these conversations with your medical team, your doctor, your dietitian, this is going to be the best way to really make sure you're meeting your needs. I've seen countless times people will say that they've been taking a certain supplement for 10 years and they've never really thought about changing it. And I don't think that's the best way to do this. I think really these things should be constant conversations. Um, for calcium, this is another one that I think often makes sense to supplement, especially if your calcium intake isn't adequate. So, yeah, we will often supplement with calcium to meet the deficit in that case. And I'll usually start by recommending a supplement in divided doses. So, you're getting that 500 milligram dose multiple times a day until you can meet the recommended intake. Again, I'm probably going to be balancing that with both food and your supplement intake. So it requires a little bit of dietary assessment too. I don't just ever recommend a supplement without understanding what someone's intake looks like. And again, this is also going to depend on how your bone health looks currently. Like once you get that DEXA scan, how much do we really need to supplement? One thing on vitamin D that I forgot to mention that I do want to say really quickly is that these decisions should be made based on blood work. And that is important because you can have toxicity of some of these nutrients. And so taking too much vitamin D well above your needs can actually be toxic to your body and to your liver. So I just really want to caution against that. The dose needs to be something you're talking about with your doctor and based on blood work. And also, it might not be necessary in the summer months when there's a lot more sunlight and you're outside more. So again, these things are always evolving. Vitamin D supplements should also always be taken with food for best absorption. With magnesium, this one, again, it really depends on what your diet looks like and how well you're absorbing nutrients. I think actually these days a magnesium supplement is a little overdone. I think people take magnesium supplements without really understanding what they're taking it for. And so there's a lot of, different supplements out there that have different functions. With magnesium, the form that you're taking does really matter. And so, like magnesium citrate, for example, this is something I might use with a patient who has constipation as a gentle laxative, but it wouldn't be so appropriate for someone who's already experiencing loose stools. So I don't suggest just taking a magnesium supplement without talking with your provider about the form that you're taking and what the goal is. Taking a magnesium supplement just to make sure you're not deficient doesn't really work, in my opinion. I think it's always good to look at what your intake is, and dietitians can be really helpful for that. With vitamin K, I honestly don't see vitamin K supplementation as necessary for most people. A lot of times you'll see vitamin D and vitamin K combination supplements, which are said to have a synergistic effect. I don't find this to be necessary for most people. I wouldn't take a vitamin K supplement without talking to your doctor at first. And honestly, I don't think the research supports the need for that. But Dr. Adams can comment on that further. So I'm going to keep this the last time I'll say that I want to keep emphasizing consultation with your healthcare team. Supplements are the decision to take a supplement should be made again based on your medications, your medical history, what other supplements you're taking, what is the status of your celiac disease, what is the goal with this supplement, and of course you want to make sure it's gluten-free. Taking these things when they're not necessary can lead to nutrient imbalances, can interfere with medications, and like I mentioned before, can be toxic in some cases. So these supplements are not regulated the same way that drugs are, so we don't always have a great understanding of their long-term use, and I just feel like these are things that need to be taken a little more seriously than I think a lot of people take them. So just work with your healthcare team is the message I hope you take from this. All right, and now I'm going to turn it over to Molly for a brief overview of our recipe.
Thank you so much, Megan. So I'm Molly. I have my master's in nutrition and I'm a registered dietitian with a food allergy and food science focus. And I did a very simple recipe today utilizing Greek yogurt and some lean ground beef for some meatballs with a spiced yogurt. And to piggyback off of what Dr. Adams said and what Megan said as well, I would just love to emphasize that this is a dairy containing but very low lactose recipe because of the Greek yogurt and it being regular dairy but low lactose. I'd love to just give a couple of insights real quick. If you cannot tolerate dairy, I'm a lactose intolerant person myself, and I try to do low dairy or lactose free or low lactose dairy personally. And so there a couple of great options for this would be to substitute. You could do basically tofu in a similar way. You could blend it and add in the same spices, aromatics for a super similar flavor and texture contrast. Another great option was we talked about leafy greens, particularly collard greens. Those could get sauteed again with the same options, aromatics, things like garlic and onions are super tasty and add a ton of flavor to dishes. And those could be sauteed and the meatballs could be placed on top of that and you could still get in plenty of calcium that way. And just taking a look at what other options there are. So by no means, if you cannot tolerate dairy or you only tolerate dairy in very small amounts, this recipe can absolutely be adapted to different things. So that's something I strive for in any recipe I create, to have various options in a way that suits all dietary needs.
It's Chef Moss, and today we have a high calcium recipe for you. It's a super simple recipe using a whipped herb yogurt and some meatballs made with some lean ground beef. So let's get into it. Here we have some Greek yogurt, about a cup of Greek yogurt. I'm using full fat, but you can use a medium one, you can use a low fat, whatever you like best. And I'm going to add that to our bowl here. Now, dairy products are well known to be high in calcium. But if you can't tolerate dairy, there are a lot of other options that you can utilize. Seeds have a high amount of calcium, and so do dark leafy greens, particularly collard greens. So if I was making this particular recipe and I didn't want to use dairy, I wanted to use something else, I would do a sauteed collard green with the other spices and herbs we're using and put my meatballs on top of that. So here is our Greek yogurt in our bowl. I'm going to add some fresh chopped parsley. I'm going to save a little bit because I'm actually going to garnish my plate with this. And then for spices to this, I'm going to add some red pepper flakes and salt and pepper to taste. If you don't like spicy, you don't have to add red pepper flakes. And if there are other spices you really love, a lot could go in here and add a lot of flavor. We're going to add some sauteed onion and garlic, but if you just really love garlic powder, onion powder, those are great options, or any other dried herbs that you like. So I'm going to add a pinch of red pepper flakes and then just a pinch each of salt and pepper to taste. And I'll taste that again at the end to make sure the seasoning is perfect. Now, this is half of a small red onion and some minced garlic that I just sauteed very lightly in oil. I'm going to add that for flavor here as well. You can use any onion you like. Give me white onion, red onion, Vidalia onion, whatever you like. And that's going to go right into our bowl. This is going to add so much flavor to our Greek yogurt mixture. I'm going to mix this up here, super simple. The faster you whip, the more air it's going to get. And that's going to make for a really beautiful presentation and a nice fluffy texture to go under your meatballs. So that's been nice and mixed. And then just to balance everything, I'm going to add a squeeze of fresh lemon juice. I'm just going to add about a teaspoon of lemon juice, give or take. And I'm just going to squeeze it fresh right into my Greek yogurt here. If you get any seeds, you can absolutely scoop those out like I did here. So scoop that out, no seeds in our Greek yogurt. We are going to mix this around really well. And at this point, give it a taste. If you want more salt, more pepper, this is time to add it. Now, for the meatballs here, we did a really simple meatball with just ground beef and spices that we baked. You can add more to your meatballs if you like adding breadcrumbs or eggs or extra spices. That is totally your call, but these are super simple. Lean meats also have a good amount of calcium. And as we know, calcium is super important for bone health in particular, especially if you have celiac, you have a recent celiac diagnosis, you haven't been absorbing nutrients for a while. So you want to make sure we're adding lots of different foods that contain those micronutrients, and that will allow you to really get them back in your diet. This does not have to be an all day, everyday focus, but adding in simple meals like this that contain a high amount of a micronutrient like calcium is a great way to just slowly integrate those micronutrients back in. So now we're going to plate, and this is really easy and beautiful. So I'm going to do one portion here. I'm going to scoop about half my yogurt, and I'm just going to make a little bed for my meatballs. So I'm going to push this down in the center a little bit, make one nice layer there, and then surrounding to sort of pull my meatballs in. And then I'm going to add 3 meatballs to this. Depending on the size of your meatballs, you can choose how many you do, but I'm going to go 3 right here. I'm going to go one more little squeeze of lemon juice because I absolutely love lemon right there. I'm going to add a pinch of red pepper flakes because I like spicy. And then to finish it off, we have a little bit more of our fresh chopped parsley. And there is your beautiful plate. You can have this with some crusty bread, some pasta or rice, and you have a wonderful meal. This is our finished plate. We have our beautiful whipped yogurt, our spices, our lemon juice, and then of course we have our lean ground beef meatballs. I used 90-10. That means whenever you see that on meats, that means 90% lean, 10% fat, 80-20 would be 80% lean, 20% fat. Whatever you like here, but I like the lean because we've got a lot more protein and some micronutrients as well. This is a really high calcium meal that you could serve anytime. It's really quick to make and it's really delicious. We're going to do a quick taste test. I'm just going to cut in half in one of my meatballs here and make sure I get a good dollop of yogurt. Take a bite. It's so delicious. The yogurt is tangy, a little bit sweet, lots of flavor from those herbs and those aromatics. And the meatballs are such a great protein punch and they're so tasty.
Well, thank you to all of our speakers for such amazing presentations today. This was so informative. I thought I knew a lot about bone health, but I continue to learn every single time I hear you all speak. So thank you for those great talks. There are lots and lots of questions that were pre-submitted and also that were submitted during the webinar. So I'm going to try to get to as many as possible in the time we have left. I want to start with the topic of brands of supplements. So there's a question about every single nutrient that you guys mentioned today and which brand is the best to buy. And that's obviously very dependent on what the need is, what levels are. But in general, if you're going to the drugstore to buy a supplement for magnesium or vitamin D, what are things to look for on the bottle to know that it's a safe one for you to take?
I mean, I would look for the words gluten-free first. That's my number one recommendation. Also, look to see if there's a third-party certification. There are different ones. USP is one of the ones you'll see a lot of times in the United States, but I would just look to see that there's a third party looking at the product to make sure that it contains what it says it does. I mean, there are so many brands out there. I think honestly, the majority are gluten-free these days, but that's my number one rule is just look for those words.
And we can also have Dr. Adams and Molly come back to the screen too, because there's going to be questions for you all as well. So there's a number of questions about how much calcium supplement to take in various ages of patients. And will the amount shift as from at the point of diagnosis to when their gut is damaged to when they are healed a year later? So how do you sort of judge what level they should be taking?
Yeah, I mean, it depends on a couple of things. I think overall, yes, the answer is it will change. It's very much going to depend on what your intake is. So if you're working with your dietitian and you're starting on a supplement at a higher level, I would say as you learn more about high calcium foods and working those into your diet, your supplement you might want a lower dose over time. Um, as far as exact numbers, it depends on your age, it depends on your disease status. It also does depend on your current status of calcium, so your bone density at the current moment. So it's just going to depend. I can't give a specific answer, but that's how I always approach it.
Great. Dr. Adams, you mentioned that you start doing the DEXA scans after a year past diagnosis. Is that sort of a universal rule for kids and adults, or at what age would you really start doing that?
I would say there are some centers that actually do bone density scans at diagnosis, so that's not a steadfast rule. We just choose to do that based on that data that shows how much improved bone mineral density you have in that first year. I actually, since I'm an adult gastroenterologist, can't speak very well for the pediatric group. But there is so much bone growth that's happening, and so they may choose other markers of bone assessment, like looking at films to see where you're at with your bone growth and how far along you are in bone development, because there are certain times in a child's development where they have less bone growth or when their bone growth has stopped. So I'll have to defer that question to a pediatrician on how they decide, but that's how we do it in our clinic.
Great. So there's a question from an attendee who has had low bone density and it is not improving after 5 years on being on a gluten-free diet. What type of physician or provider or question should she be asking next?
Depends on the severity of it, but if it's not improving, but it's been steady, just mild osteopenia, I think that's actually really encouraging, right? So although it didn't get better, it's not getting worse. And so sometimes I like to talk about that, right? As opposed to declining. If you're in the osteoporosis range and or if you've ever had a fracture in the setting of thin bones, which technically puts you in osteoporosis, you want to see someone that specializes in osteoporosis. Now, this can vary. For example, at our hospital, both endocrinology and rheumatology do it. I know in the community, a lot of GYN doctors manage that as well. And some primary care doctors feel comfortable doing it. So I would just have the conversation, whoever is primarily managing your overall health, that tends to be a primary care or your gastroenterologist, and just ask them if, what do they think about when you would start a medication or need to see a specialist.
Great. There's a question in the chat about whether or not celiac is an appropriate diagnosis that would require Medicare or other health insurers to cover the DEXA scans.
So I have not had an issue with reimbursement. One of the codes you can use for a bone density scan is malabsorption, and so that falls within celiac disease. So I personally haven't had a problem with my patients getting it paid for.
Great. For Molly or Megan, do non-dairy milks like oat milk, coconut milk, or almond milk have a high calcium content?
Generally speaking, no. Some of them may be fortified, but yeah, for the most part, not as much. Molly, feel free to chime in.
Yeah, I was gonna say the exact same thing. Those non-dairy milks are can be a tasty alternative, but when it comes to micro and macronutrients, you could even throw protein and some other things in there, unless they are having some sort of fortification process, and they are pretty low in those things. If you can tolerate dairy and not tolerate lactose, a lactose-free dairy-based milk is your much better option.
Great. So Molly, there's a handful of food-related questions. There's some questions from parents who have young children, and they want to know practical ways to incorporate all the foods that were talked about today into their diet when their kids do not want to eat things that are green. So any suggestions for these parents?
Yeah, this is actually my wheelhouse. So, fun fact, while I was becoming a dietitian, I actually was a full-time nanny for a family in Boston whose children had recently been diagnosed with some malabsorption based disorder. So I got to practice this in real time. So one of my favorite ways when you have little kids is to use color to your advantage. A lot of those dark leafy greens really lend themselves to smoothies. And if you blend in frozen pineapple and half a banana and some dark leafy greens, get some spinach in there. I've done it with collard greens. Get some kale in there. It turns this beautiful bright green color. You could call it monster smoothie. You can call it, the green eggs and ham, whatever you want to go with. And it is so much fun and super tasty. So smoothies are your friend, especially because kids are going to naturally gravitate towards something like fruit, which is sweet and fun. And again, it can make these beautiful colors. Some things I would also do with that is I'd make like two different flavors of smoothie and then I would put them in one glass and it would look like a layer and people would get all excited. Something else that can be a really great option, and I can go deeper into dairy, but just trying to keep in mind some non-dairy alternatives, is using some of the higher calcium based foods in like baking, right? So integrating some almond flour could be awesome. Kids like cookies, they like sweets, they like banana bread. And if you can integrate some of those, gluten-free flours that actually contain calcium, that's a great option. Dairy in general is a super helpful product. It's got all sorts of great micronutrients and macronutrients, and it can really lend itself in a lot of ways into things. And it can be something as simple as, okay, my kid's playing out in the snow today. I'm going to make them hot chocolate and make sure I use some milk here or something that's going to integrate that way. Or on the flip side, you can do something more like with your everyday dinner. If you're going to make like a pasta sauce and you're putting in some vegetables, you can put some collard greens in there chopped really small and you don't even realize it's added. It's just part of a food that's already common and comforting to them.
Thanks, Molly. So there's one more question that I think you're going to be perfect to answer. So what we didn't share in the introductions is that in addition to Molly being a dietitian, a medical chef, and involved in so many things, she's also a professional athlete and has played for the women's professional football team in Boston. And so this question comes from the parent of a child who was diagnosed with celiac disease after repeated pelvic fractures that they thought were due to sports injuries. And so the question is actually about how to eat well for bone health on the go and, being a normal, busy, growing teenager. But so thought you could perhaps shed some light.
Yeah, absolutely. This is something I get asked quite a bit about. How do you pack food for traveling? How do you pack food that's fueling enough as a fully gluten-free athlete in a really high elite level? Something that I've really come to realize is find a couple of staple things that you enjoy always. For me, and this is a super simple one, and obviously calcium in particular can be integrated into this. I love sandwiches. I put them all over my Instagram. All my friends know it. I love sandwiches. So anytime I travel or I'm on the go for sports, I bring a package of gluten-free bread. I bring a loaf of my favorite gluten-free bread. I know anywhere I go, I can at least find a convenience store. If I'm looking to increase calcium, I'm obviously going to look for things like dairy to add to that sandwich. If I'm looking for protein, which is also going to be super important, I'm looking for maybe a packaged deli meat. And it is so simple and it doesn't take too much effort. It's also not that expensive, which can be really difficult when you're on the go for sports. The other thing that's really important to keep in mind is what you are eating pre and post athletic event. What you are eating before and what you are eating after to replace what you've lost is vital to making sure you're recovering appropriately. You won't perform your best, nor will you recover adequately if you aren't paying attention to that. So before you're going into something, you need to make sure you're properly fueled. I won't go too deep into that at the moment, but things that are really easy on the go can truly be something like, okay, in this case, we're doing a dairy-based, drink of sorts, a shake, something that's going to be fueling. And how do I make sure I integrate that with me? And I really just find the best way to do that is to find a couple of shelf-stable products and make sure I have them on me at all times. You can actually bring liquids and some other things through airport security as long as you have a valid medical reason. They will stop you at TSA, but they'll check it and then they will give it back to you. So something to bear in mind.
That's great. Dr. Adams, after diagnosis and being on a strict gluten-free diet, does the risk go down for bone health issues later as long as they maintain the strict gluten-free diet?
Yes. So after you've healed your gut, and assuming your strict gluten-free diet is healing your gut, right? And your labs are coming down, and if you get another biopsy and it shows improvement, your risk of bone loss above that of the general population is very minimal. So you start to follow the trajectory that someone else of your gender and age would have.
Great. So Molly, there are some very in-depth cooking questions here. Does cooking bone-in cuts of meat draw out any more calcium from the bone to put into your consommé?
So this is a great question, and I actually love this. Bones are super underrated. So when you have something with a big bone, and why we talk about really tiny fish with bones in them being high in calcium, that's why they're high in calcium, is because we're actually consuming the bones. So any opportunity you have to break down those bones, whether you're cooking something for a long time or particularly in a broth or a consomme, is going to add in calcium and other micronutrients. It's going to add in collagen and some other great things. A great tip for it as well to help break down the bones is to add a splash of vinegar or some other acid, a splash of lemon juice or something like that. It actually helps the bones to disintegrate a little bit better in the liquid and release some of that. It's not going to put you over the top on something like your calcium intake, but it absolutely is a great option to get a little more in a really easy way.
Thanks, Molly. Dr. Adams, is there any relationship between having a higher Marsh score on the biopsy and issues with bone health?
Well, if you have a higher March score, you possibly could have been malabsorbing, worse for a longer period of time. So it depends on how long that has been happening. But in general, again, even people with a higher March score, once we get that healed and you have that year of healing plus some, you're going to start absorbing your calcium a lot better. But yes, if you've had severe malabsorption for a longer period of time, you are at higher risk for more bone loss at baseline.
Great. Molly, would it be appropriate to use almond meal in the meatballs to add more nutrients?
I love this question. Absolutely. I put as an option to add in breadcrumbs or Parmesan cheese. If you like those things and wanted to add them, something like a ground almond flour is fantastic. You're adding in a little bit extra protein, you're adding in extra calcium and other, healthy fats, etc. And it's so easy. Adding a quarter cup of almond flour to a lot of recipes isn't going to change the texture too much while adding those micronutrients. I encourage that fully when people ask me questions about this. Just remember that almond flour is literally ground almonds. So if you're trying to substitute it 1-to-1 in a recipe, it's a lot more fat and protein dense versus carbohydrate dense. So keep that in mind. But it's something like a meatball, adding almond meal is a great option.
We use it now just to bread chicken tenders, just lightly dredge it in the almond flour, and it's so good.
We do something similar. We do chicken cutlets that are part breadcrumbs, and we grind in almonds or pistachios and do the same thing.
Awesome. So one of the things that has been really interesting to me as I've gone through, there were over 200 questions submitted before the webinar, and then again, the ones that were submitted during the webinar, is it seems as though a lot of the people attending today do not currently have a dietitian that they work with, and some even asking questions about how to get in touch with a physician that's connected to a dietitian that knows about celiac disease. Dawn and Megan, do you guys have any suggestions for these patients on getting connected to the right types of providers to help them with this?
Yes, so I just shared a link in the chat with the Celiac Disease Foundation Healthcare Provider Directory. It has a lot of wonderful dietitians that are all vetted and have all taken a specific training program in order to be included in the directory. So that's where I would go first for dietitians. I'll let Dr. Adams take the physician question.
Yeah, I think the Celiac Foundation has a similar program listing physicians. There's also a professional society, the Society for the Study of Celiac Disease, that you could have your gastroenterologist, if they don't feel comfortable with celiac disease, reach out and try to network or find someone to refer you to with celiac disease. But it can be difficult. I do hear from many patients that they have a hard time finding a provider that specializes in celiac disease. I think also if you went through the dietitian too, they might be a great resource to let you know who they've worked with and found really helpful in terms of healthcare providers.
Great. Thank you all so much for this amazing information. You've shared so much wisdom today. We just have a couple of minutes left, and so I want to put up these last slides. For healthcare providers who are claiming credits for today's seminar, we need you to complete the follow-up survey. That code is up on the right-hand side of the screen, and Emma has also dropped it into the chat. We need these completed by Monday evening at 5 p.m. In order to process the credits. For patients and caregivers who are attending today, there's a code on the left for you to scan, and Emma has also put that one in the chat. Again, completing these surveys is quick and simple, and it really helps us evaluate our programs and hear from you on other things that you want to learn. So we very much appreciate you taking just a few minutes to complete those surveys and give us your feedback. Also, please save the date for our next culinary medicine webinar. It's called Smart Savings, Gluten-Free on a Budget. This seminar will be on Tuesday, April 1st, 2025 at 3 p.m. Eastern, 12 p.m. Pacific. And as always, it is accredited for CEUs for physicians and dietitians. We have heard from all of the psychologists, social workers, and nurses out there, and we hope that by this webinar, we will have it in place for you all to get continuing education credits as well. So thank you again to Dr. Adams, to Molly, to Megan, and to our team on the back end working on this, as well as to our Spanish and Portuguese interpreters. We hope you all enjoyed the webinar. The video will be available tomorrow on our website.